Welcome back, students. Today we have with us Dr. Shikha to tell us her success story. She has achieved a wonderful rank 28th and she has been allotted a seat of her choice, Fernandez Hospital for Maternal Fetal Medicine. Dr. Shikha, many congratulations on this success. And I believe that this was your first choice and you took the exam only to join Fernandez Hospital for Maternal Fetal Medicine. So brilliant on having achieved your dream, and let's hear your story. Over to you, Dr. Shikha.
Thank you so much, ma'am. As you said, ma'am, yes, I wrote this exam just to get fetal medicine in Fernandez. I wanted no other field, no other center.
Okay,
so I'll say that has been possible. Yes, it has been our work and support from my family, but definitely mentor like you, it wouldn't have been possible without your mentorship, ma'am. That's for sure.
That's lovely. That's thanks for those wonderful words for me.
You are an amazing teacher, ma'am, and I believe so many of us who've been able to achieve whatever place they wanted, whatever field they wanted, it is because of your guidance.
That's so nice.
Say that.
It is such a privilege to be a part of such important things in your lives. So tell me about yourself. Where did you do your UG and PG from? Which year you completed your PG, and how did you decide that you will do fellowship?
Yes, ma'am, my UG is from KMC, Manipal, and my PG is I did DGO and then DNB, both in Calcutta.
Okay. Wonderful.
From Medical College, Kolkata, and then the DNB was from another government institute, Shambhunath Pandit.
Okay.
So basically, I thought, because these days, ma'am, super specialization, I feel it is very much needed now.
Yes.
It is very much needed now. It is the time of super specialization, I believe.
That's
so in 2000, yes, so in
Yes, Dr. Shikha.
Yes, ma'am. Ma'am, so in 2019, my husband shifted to Vellore for MCH reproductive medicine. So that was the plan, that I would be writing in 20 or 21.
I remember this story. You told me your husband is already doing reproductive medicine. So you want to do the complementary field, you want to do fetal medicine.
Yes, that was our plan, ma'am. I wanted to do one thing. I liked fetal medicine. Second thing, I wanted a complementary subject.
Wonderful.
So the plan was in 20 or 21. I'll write an exam. So I started my SRship in CMC, but then because of COVID, I have a child, ma'am. I have a daughter. Okay. So because of COVID, then I had to leave my SRship midway, and then I was just me and her alone there. My in-laws couldn't come to Bedore because of COVID. So in 21, I started preparing. 20, I wrote the exam just to know what are the questions, what type of exam, and where I exactly stand. I did not prepare. I just wrote it. In 21, I started preparing for the exam.
So 21, when exactly did you start preparing?
Ma'am, something like March, something February, March, around that.
And when did you join the course?
I got to know it in March. I joined your April crash course, ma'am. You started a crash course on 1st of April.
Okay.
This is when I joined.
That crash course, I think, went on for a long time.
For a very, very long time.
Very long time, because the exam would get postponed.
Exam got postponed.
Never a crash course. The name was just crash course.
Yes, ma'am.
So which all books did you read, Dr. Shikha?
Ma'am, for infertility, I read only your notes, nothing else.
Wonderful.
There was so much in detail. Even my husband used to see your notes and say that it is like so much in detail and so precise. Wonderful. So initially I had read Kamini Rao, but then after that, when I took your classes and I read infertility from your notes, I deliberately did not read Kamini Rao again, because I believed I did not want to learn it the other way. I read only and only your notes for infertility. Onco, I read Berek and Hacker, ma'am, but only the main cancers part. Okay. The initial part, I read your notes, because I did not have the time to go through the initial part of Berek and Hacker.
Right. You were taking care of a baby also while preparing.
Yes, ma'am.
While all of this dedication was there, you were taking care of a baby. Wonderful.
So, and for OBS, I read your notes, ma'am, and guidelines, ACOG and RCOG guidelines. Spare off, ma'am, I wrote only the endocrine part, the PCOS, hirsutism, puberty, and all those chapters.
Okay.
Only that part, ma'am.
Only that part.
And actually a few guidelines that you had recommended, those guidelines, ma'am.
Okay. So is it very important to read books like Speroff and Berek and Hacker? The students who are preparing and the exam is maybe in the next 2-3 months.
I believe Speroff is needed, ma'am, because it's a good book for endocrine.
Okay, to understand
and
endocrinology.
Berek and Hacker, I believe, ma'am, only the main cancers part will be enough. The rest of it is so vast. I read only your notes, so I felt that is more than enough. Reading your notes for the initial part of onco.
So last 1 month, how was your revision?
The last for 2 months, I separated from my daughter. I went to my parents' house.
Okay.
So that was very much needed. For one and a half months, I was away from my daughter. So that is the time I just revised a lot, ma'am, as much as I could.
Okay. So how did you revise? Did you make your own notes? Had you?
Yes, ma'am, I made few notes here and there, like your classes, whatever you used to say, I used to make small little pointers out of it. Whatever you said in class, ma'am, few questions, they were like just like as if you have set the paper.
That's so nice of you.
Exactly what you had said. I don't remember the question. There was one question on fibroid, I believe, but while giving the exam, I was like, this exactly Mona ma'am had said, and it came as a question. Like your notes are excellent for especially for revision part, because in the end you don't have time to go through everything all over again.
So this is what I wanted to hear from someone, that the notes itself are concise and you need not make notes out of the notes.
Yes. I did not make only few pointers. Whatever you used to say, a few pointers here and there is what I used to just write. Otherwise, I revised infertility especially only from your notes, nothing else.
So those notes are concise enough that you can revise in the last.
More than concise, ma'am.
Okay. That's wonderful. So it's very good advice that you're giving to the students. Tell me about the exam. How did you decide which all questions you will leave?
I thought first I'll go through whatever I know and I'll just finish that and I'll see where I'm standing, and then I will come back to questions which I'm not very sure of. So in first go, I think something like 80-85 questions I could answer. So
that 85 questions, you were very sure that you know them.
80-85 I was sure of. Yes, ma'am.
Okay.
Then I went back through the questions that I did not answer, and then accordingly I started making guesses and marking.
So in total, how many did you mark?
I think, ma'am, I left something like maybe 5 or 6, something like that I left.
5
not more than that. 5, I think.
Pretty average. This is what students are doing. The toppers have left 2 to 7 questions. So you left 5 or 6 questions.
5 questions I left.
This is what all of them have said. So this is, at least you have to attempt more than 90 questions.
At least that much you should be able to attempt. If you can't attempt 90, then you are out of the race.
Probably your revision is not up to the mark.
Yes. Yes,
so
ma'am. Revision is a must. Yes. That is a must. Yes.
So, did you read Speroff? What was the last month when you read Berek and Hacker and Speroff? Because now I get this question a lot, that do we have to read Speroff now 3 months before the exam?
No, ma'am. Speroff I had been reading from the start, but I did not read whole book. I read only 4 or 5 chapters, the endocrine chapters. That is it.
Okay.
I did not read any other part. Rest of the part I read whatever you taught. Like PCOS also, you taught it so well that you really do not need to go even through the ESHRE guideline.
So yes, I have compiled both of them. There were 2 classes.
Both of them. Especially your PCOS is so good that it's a mixture of both Speroff and the ESHRE
guideline. You get so many questions from the ESHRE guidelines. Every year there'll be at least 1 or 2 from the ESHRE.
I remember that you saying in the class that PCOS ESHRE, you will get a question every year.
And I'm sure there was a question from
There was question,
both
yes,
in
ma'am.
FET and FET, ESHRE, PCOS guideline, there are going to be questions.
Yes, ma'am.
So that is wonderful talking with you.
But you are godsend, ma'am, for us, because see, when I started preparing, I was reading, but when I started attending your classes, I felt how wrong I was going. If it wouldn't have been your guidance, I wouldn't have cracked it. It is a work, I believe. Yes, I know it is a hard work, but the guidance is very important to know what to read and what not to read. I was going through Williams and everything, and then you said that no, you have to read the guidelines and then Williams. That is what I did, and I realized how different difference it made.
That is so good.
The guidance that you gave, I was absolutely I was taking the wrong route. That is, I can say.
It really gives me goosebumps to know that I have been helpful in letting you achieve your dream. It is wonderful. It's a wonderful
Absolutely, ma'am,
feeling.
because this was my dream. I wanted fetal medicine from Fernandez. That is it.
Yes, it is a very good institute. I remember the time when I took. Even before that, people would tell me that for fetal medicine, that is the best center in the country.
Yes, ma'am.
It's good that you have got the center and the subject of your choice. Now, one question: how did you decide about? Okay, so you told me it was complementary. Any more tips about deciding between fetal medicine, reproductive medicine, and oncology?
It all depends on what your preference is. For me, I do not want oncology because I believe it. I cannot see so much of pain and suffering in onco. So one thing.
You know what? Nowadays, that's a belief that there's so much pain and suffering in oncology. Nowadays, the cancer outcome has improved, and there is
improved.
It has improved.
That is true.
Yes, I have seen cancer patients very closely. It has improved, and there is not so much pain and suffering.
True, ma'am.
They do get cured.
To each his own. For me, oncology I was not interested in oncology.
Me too. I wasn't interested for the same reason. For the same reason that it is going to, I get very attached with my patients, and I would be in pain and suffering because of them. But now, if you see, after reading oncology so much, I do understand that the outcome has improved, and that shouldn't, scare you from taking gynecologic oncology.
That is what, ma'am,
if you're interested in it.
If you're interested into each his own. Like I was not interested in oncology as such also. And for infertility and fetal medicine, I had more liking for fetal medicine. I liked OBS.
Because students, are just after their post-graduation, they're so scared of obstetrics that they don't want to take such a beautiful branch like
But you cannot run away from OBS, ma'am, whatever.
Right. That's they have to know.
Even if you choose IVF, you
Any
have
branch
to do OBS.
IVF leads to OBS. So choosing IVF is,
does not mean that you will not do OBS. You have to do.
You have to do OBS. So obstetrics, of course, if you ask me now, my interest is mostly in fetal medicine. Since I'm teaching all the subjects, fetal medicine is extremely interesting. Oncology is the next interest that I've developed recently, and reproductive medicine takes a backseat after I started reading both the subjects. So all of them are equally interesting. You have to realize which one.
You have to realize what you like. That is what to each his own. What is your preference?
Right.
For me, one thing I liked fetal medicine. Second thing, I wanted a complementary subject.
Complementary subject, right?
Yes.
So it was so nice talking with you, Dr. Shikha. Thank you for giving me your time from your busy schedules now that you're joining.
Thank you so much. Yes, ma'am. And lovely speaking to you, ma'am. And thank you so much from the bottom of my heart. Thank you so much for your guidance, and I feel so lucky I came across you. Actually, Megha's told me about you. She is the last year,
Dr. Megha
2020 MCH candidate.
She was at the previous coaching. She was in the previous batch.
She told me about you, and I thank my stars that she told me about you.
And that is so nice of you, Dr. Shikha. The feeling is very mutual. I feel so lucky.
Ma'am, you're not audible. Hello?
Hello?
Yes, ma'am.
The feeling is very mutual. I feel so lucky to have come across intelligent students like yourself who did follow my advice and who got, a seat of their choice, a seat that